Okay, so welcome everyone. I'm happy to be here. My name is Amelie Pedneault. I'm an assistant professor in the Department of Criminal Justice and Criminology in Pullman. I was practicing my talk today, and by mistake, I said associate professor because I was told that I had gotten tenure about a month ago, but it's not still in act until July 1st. So I am an assistant professor. I do want to acknowledge also my co-author on this, Dr. Catherine Dubois, who cannot be here today, but is very much part of both the research that I'm presenting today, and she also participated in putting together that presentation. So I want to give credit where credit is due, and a lot of credit is due with Dr. Dubois. Okay, so today I'm going to be presenting on problem specification for targeted intervention of sexual violence and intimate partner violence. I know this is a mouthful, but as I go through my presentation, I will get to explain kind of why it's titled this way, and hopefully we can have a brainstorm session about good ideas that could be implemented. Okay. Yes, a little bit about what I'm going to be talking about today. So first, I'm going to be situating you within kind of the literature on situational crime prevention from the field of criminology and how that could be useful when we think of, preventing violence, specifically in the context of sexual and intimate partner violence. Then I'm going to be briefly presenting two projects, one on campus sexual assault and the other one on intimate partner violence. And I say briefly because I could go over time with just one of those. So it will be kind of wrap it up and keep it on topic. And finally, we'll get at why problem specification matters, specifically when we think of designing kind of intervention measures that are going to be effective. Oh, you can see that I don't have a clicker in class because I have the tendency to always go back and flip, but I also like to walk. Okay, so situational crime prevention, what is that? So that's kind of a subfield of criminology that really focuses on preventing crime by reducing the opportunities for that crime to happen, right? So it has a very kind of practical aspect to it in which we want to impact something about the environment that is going to reduce opportunities for crimes to be committed. There's a couple of ideas that are kind of underlying this idea of situational crime prevention, and let me explain them to you very briefly for situational crime prevention 101. So the first one is that we don't think crime is only the result of someone being predisposed towards committing crime, of being motivated in committing crime, but it's also very much the byproduct of the circumstances in which crime happens. And what that means is that the environment matters, right? And those environment basically we're going to posit have kind of a set of costs and benefits about committing crime in that specific environment versus a different environment. When I talk about environment, I of course mean the physical environment, the location, the time where crime happens, but I also mean the social environment, right? What are the norms about that place and what's acceptable, what's not acceptable in that place, things like this. And of course, we don't stay in the same place and in the same context, right? So as I go to work, I leave my house and get to the university, and then I am at soccer with my son on Saturday morning. So our routine activities end up, by displacing people at specific place or removing them from other places, end up creating kind of those crime opportunities because either lots of people are there or no one is surveilling some object, like things like this. And that has kind of allowed situational crime preventionists to come up with 5 larger categories of how we can go and think of preventing crime, right? So the first 2 are about increasing either the effort that's required from the offender to commit the crime, or increasing the risk of being detected, of someone intervening, of someone saying something when you're trying to commit that crime. The next 2 are about reducing, right? So we also want to think of how can we modify either that physical or that social environment to reduce the rewards that would be gotten from those crimes, or to reduce the provocations, which are those kind of factors that might incite or push someone towards more kind of criminal behavior. And finally, the last type of intervention is thinking of removing those excuses, and those excuses are the ways in which crime might be rationalized, right? That it's acceptable under certain circumstances or something like that. everything that has been written about situational crime prevention ever mentions the need for crime specificity, right? In order to be able to implement those intervention measures and them to be effective, we need specificity. And let me give you an example that has nothing to do with violence, but that most of you will understand. If we want to prevent car theft from happening, right, we need to know what type of car theft we're talking about. Because some people steal cars because they want to go on joyrides. Some people steal cars because they want to strip all of the pieces and sell them. And some other people steal cars, put them on boats and ship them to different countries where there's no risk of the car being retrieved or something like this. If we want to do something that's going to impact whatever car theft is happening, we need to know which type. Today, I'm going to make the same argument for sexual violence and for intimate partner violence, right? A lot of times, we hide behind those kind of big statistics to illustrate the magnitude of the problem, but we lose sight of the specificity that would be needed to really think about how can we prevent those crimes from happening in the first by aggregating kind of sexual crimes together. In the campus context, for example, every single one of you has probably heard of the 1 in 5 statistic, right? 1 in 5 women is going to experience sexual assault during her kind of undergraduate career. That's a statistic that everyone knows, but that statistics hides a lot of context and hides a lot of types of sexual crimes that if we just stay with that statistic, we won't have kind of any meaningful anything coming out of, okay, we need to intervene in that very large context. Okay. That brings me to my very first research project, right? So in that one, Dr. Dubois and I wanted to delve into that 1 in 5. Let me just put everything up there because I am going to forget. Okay. Delve into that 1 in 5, right? So the 1 in 5 has been found kind of over and over again, but there are kind of a set of commonalities in the context in which it has been found. Specifically, it's mostly at universities that have high research activity, that have big endowments, that have big athletics program, that have kind of a vibrant Greek life going on. And we know that that's not representative of the typical kind of student experience going to college in this country. So to get a better sense of what was going on, we used the National Crime Victimization Survey, which is a nationally representative survey, and that asked respondents over a number of time period. In most cases, it's 3.5 years. So every 6 months, they will check in with them and ask them about specific crimes that they might have been victimized by. And one of those is sexual crimes. So we wanted to see for women that are 18 to 24, what is the occurrence of sexual crimes, and can we see differences based on if they're enrolled in college, and kind of getting into that specificity that I was talking about, can we see other difference when we start making finer distinctions? So we use generalized estimating equation to account with robust standard errors to account for kind of the repeated measure aspect in the complex survey design. And then we controlled specifically for if the respondent was 18 years old at the age of answering the interview, because we know that 18 is where the risk for sexual violence peaks. And we also accounted for if it was their first interview, because remember, there's repeated one. And we know that the first one, telescoping is more likely to be an issue because you're more likely to go outside of the reference period that is given to you for that very first one. Okay, so what did we find? So for women that are aged 18 to 24, and remember that is a nationally representative sample, if you account for those that were enrolled in college to those that were not enrolled in college for the full time period that we consider, which is 2007 to 2021, it's at the kind of the left-hand side, no statistical difference. So you could consider kind of the risk of being sexually victimized, whether you're in college or not, to be equivalent in both of those. If we start disaggregating by year, we're finding some interesting patterns. I don't have time to talk about those two ones specifically, but feel free to ask about them in the Q&A if you're interested. Okay, so technically, if we stop there, right, we would say, okay, so college doesn't seem particularly more risky than not being in college. And you know, if we don't think of problem specificity, one might be tempted to stop there. we wanted to account for, what happens if you live on campus versus if you travel to campus. Because if you think back to that 1 in 5 statistic, you would think that most of those findings seem to apply to the residential campus experience as opposed to the I'm commuting to campus. So when we look at this for the full time period, what we find is that women that were residing on college campuses had almost 3 times the risk of sexual victimization than the one that were traveling to campus. So we are starting to, get into that detail of, okay, if we need to focus, if we need to come up with intervention measures, we need to focus on the one residing on campus, or at least the risk factors for sexual violence are very different in that context than they are not in that context. So we wanted to add even more specificity, right? And we wanted to account not only for are they residing on campus or not on campus, but also what types of sexual violence are they being victimized at. If we aggregate sexual violence kind of together, what you'll see at the left-hand side here is that there is a statistical difference, right? Residing on campus is more risky, so you experience more sexual victimization than if you don't. But if you break it down by type of sexual violence, though, you can see that for rape, the statistical difference is not there. So for rape, whether you are on campus or not, same level of risk. For sexual assault, though, which is, those behaviors that are not penetrative, huge difference, almost 5 times more likely to experience that type if you reside on campus than if you don't. So problem specification matters, right? This is giving us clues about in what context sexual violence occur, hopefully for us to then design better prevention measure around this. Second project, the project on intimate partner violence. I will preface this by saying this was only conducted by Dr. Dubois. I have talked to her. I think I'm prepared to talk about this, but we'll see how it goes. Okay, so her project also started with a noted discrepancy in the research, right? The discrepancy between, is it riskier in terms of intimate partner violence to be living in a rural area where arguably no one can hear you scream, no one can call the police, like the police is far even if they get called, which one would think theoretically makes for, okay, that might be riskier in that context, or when you're living in a kind of metropolitan area. Dr. Dubois used exactly the same kind of data sources, a national crime victimization survey, almost 500,000 women in that one because it's not restricted by age, and she used a different kind of year range here, same type of analysis, controlling for the repeated design, all of those things, and then control for age, race, and ethnicity in that context. Okay, so first, on the left-hand side, what you'll see here is kind of this distinction, the traditional distinction between urban and rural IPV, right? So what that would tell is that technically women that live in urban contexts seem to have higher kind of rates of intimate partner violence than women that live in rural contexts. However, Dr. Dubois thought, and I agree with her, this dichotomy of urban and rural really seems to be losing some of the nuance that we might need to better understand intimate partner violence. So she kind of accounted for, okay, what if we distinguish between central city, suburban, and non-metropolitan, like where these women lived when they reported those things. And now you can see some interesting patterns starting to happen, right? So really women living in suburban areas are the one with the lowest experience of victimization. So higher is women living in central city or women living in non-metropolitan area. Dr. Dubois persevered and made even kind of finer distinction, right? Ending with those 5 categories of, the urban central city, the suburban context divided between, the suburbs themselves and what she calls the exurbs, and then the non-metropolitan, which are a small town, maybe like Pullman, for those of you familiar with Pullman, or the dispersed rural, which are really kind of far out in what we would think when we think of rural, right? And she is finding all of those interesting nuances. And I will say specifically, and I know the colors are coming across horribly right now, so I apologize, but specifically that the highest level, the highest risk of intimate partner violence is in the small town urbans, something that was not at all captured with the prior distinction. And one that is pretty high as well is kind of the urban central city. Okay, problem specification matters, right? Because if you think back on those results, when you started, college would have been, college is not a factor. We don't need to do specific prevention there. Maybe we just focus on the age group generally. And then it would have been, okay, let's focus on urban. Let's not consider kind of the rural context. When you start making those distinctions, though, it is pointing to things that we might want to be thinking of. And the etiology of violence in that context might be very different from one to the next, right? So on college campuses, we want to be thinking of students that live on that campus, and we want to be thinking of sexual assault specifically more so than rape. If we try and tie that back to situational crime prevention, two things that come to mind is kind of that culture with regards to space. Why is it so acceptable on college campuses to be groped? Why does no one intervene? Is there no surveillance design? Like, what does it look like to prevent that type of sexual assault from happening? And I am now kind of delving into this with new data, but some specifically locations that have to do with leisure is where most of the groping seems to happen on college campuses. And we want to think of how can we modify the environment so we modify the cognition of the groper. There's probably thinking about excuses, right? How is that behavior rationalized? How is it acceptable to do those things? If you start reading on hookup culture, you will very quickly become convinced that it's just accepted as being what's happening in some spaces in university. So we can also work on this in terms of targeted intervention. If you think of intimate partner violence, there's kind of two different types that really appear, right? We want to be thinking of what that looks like in in those big metropolitan cities and what the causes might be, because we know there's services in those cities, and yet it happens. So it might be speaking more in terms of prevention of, those core poverty, high crime areas, all, living below the poverty wage, all of those things kind of combined together is what mightn't be needed in those circumstances. In small town, in rural areas, small towns like Pullman, it might be a service accessibility issue, right? So they're kind of in the middle of, we're still a town, but there's not a lot of infrastructure to help maybe victims to hold offenders to be accountable. So two very different things might be going on. And again, we can only get there and make this better by having kind of problem specification, right? Going into the finer grain and stop aggregating everything together. Okay, this is what I have. Contact information. Yay.